And all, we're now live, I believe. Not a great angle on the TikTok, is it? No. Leave it at that. So it's Tuesday, 7 o'clock. You got the Q's, I got the A's. Yes, this is right. That's a Q&A with yours truly, Plastic Surgeon to the Stars. If you have any questions, then please feel free to chip in because, you know, that's what I'm here for, basically, to answer questions, essentially. So I've got questions that have been asked throughout the week. So I will regale you with the answers presently. But as I say, I am very happy to answer anything that crops up that is within my remit of expertise, which is largely plastic surgery based. So the first question that I've got is here, and it goes a little bit something like this. It says, when can I return to the gym after areola reduction? So walking and stuff is good straight away. So an areola reduction is a local anesthetic procedure, walk in, walk out. So you walk out the door once you've had the local anesthetic, once you've had it. So walking is good straight off the bat. The thing about it is that you have a waterproof dressing on, which doesn't really breathe because it's waterproof. So I wouldn't get hot and sweaty, and that dressing's on for a week. So I probably would avoid anything too activity related for a week, and then the dressing comes off, and then we'll see how your wound's healed. Sometimes it's healed really nicely. Sometimes there's bits of areas where it's not healed that well because it's often puckered up by necessity. The wound's always puckered up because an areola reduction involves puckering the wound kind of down. So there's often bits which are not maybe not as healed as well. So I would say a couple of weeks to get the wound healed. After a couple of weeks, you can start doing things, kind of more active things. You probably don't want to be putting too much tension, I suppose. Everyone's doing weights these days. That seems to be the thing to do, isn't it? No one. I mean, when you go to the gym, you see people on the running machines and stuff, but I don't know who they are because everyone I speak to says they do weights. Weights is the thing. It's not a world that I am familiar with, so don't want to make out that I know too much about it. But from my observation of people in the clinic, like everybody says, I do weights. They all do weights, and male, female, doesn't matter. They all do weights. And yet when you look at the gym, there is quite a lot of people on those running machines and the stepper and all sorts. But I don't know, maybe you do both, do you? But nevertheless, I'm digressing. The point is, weights probably you want to be leaving off for a few weeks just because it's going to put tension on your wound a little bit, maybe. So maybe leave off the weights for a few 3, 4 weeks. Leave off the weights, I'd say. Say hi, Mr. No. Hi, Mr. No. My Charles, Victoria, good to see you here. Anyone else can say hi to? Go pin your goal. So more of you. Okay, I'm going to pin it. I'm going to pin my goal. What is my goal? I didn't know I had a goal. Got a goal apparently, which I will pin. So that's So it's not too bad an areola reduction. So maybe taking it a bit easier. Come hit the first goal with me. Pin. I've got a message. How do I see the message? Okay, this guy knows what he's doing. Okay, you're looking at a professional right here. Okay, he knows what he's doing. He's managing it. He's adapting. He's got a message on TikTok, but he doesn't know what it is. So if you've messaged me, I'm not ignoring you. I just don't know how to find the message. So good. Let's just move on. That's what we need to do. We need to move on to the next question. The next question says, do we offer aspiration of fluid? A little bit vague that, if you don't mind me saying. Do we offer aspiration of fluid? What, fluid on the brain? Fluid on the lung? I mean, depends where it is, depends where the fluid is. So the classic area, I guess, is a tummy tuck, which will be a seroma, which is kind of fluid that collects in the space where, you know, they've done the tummy tuck, and that's a relatively, maybe not common, but, you know, not uncommon. Is that the same as common? I guess it is, strictly speaking, but sounds a bit kind of less common than common. So I'm going to say not uncommon. It's not uncommon to have fluid collection in a seroma following an abdominoplasty, and we do aspirate the fluid on our patients. I don't really see other patients. I only really treat my own patients. So if you are a patient of mine, and you have a seroma, then I'd be very happy to aspirate it. I've got to be honest, I don't want to big myself up, but it's very rare in my practice. I've only had a couple in my life, basically, so it's very rare. But I do use drains, and that's one of the main reasons I do still use drains. It's a bit of a contentious issue in terms of tummy tucks. A lot of people are not using drains, and I do now do quilting, which has reduced the drainage. So I'm thinking about maybe moving away. But anyway, to be honest, I'm not used to doing that many tummy tucks these days anyway. So, yeah, point is, if you have a seroma, then we would be very happy to aspirate it for you. But if you are, so that this question suggests you're not one of our patients, because you wouldn't say, do we offer aspiration of fluid? It suggests you kind of got a seroma. So what I would say is that's kind of like the responsibility of the operating surgeon / clinic. So they should really look after you, because the way it works is that you kind of pay a fixed price for the whole package. You can't really get aftercare as a separate like add-on. So if you have surgery elsewhere and you want to be looked after post-operatively by a different practitioner, I would imagine it's quite hard to find someone to take you on, and certainly I won't take you on. I kind of look after my own patients. It's just the way the industry is set. We don't really have kind of prices for instance, aspiration of seroma. There's no price for that, because that is free for our patients. You don't charge for that sort of stuff when someone has a seroma. That would all be included as part of the service. So if you have a seroma, I would say go back to your surgeon / clinic, and they should be able to look after you for free. It's not really something that I don't think anyone, well, I don't know, I don't want to talk for other people, but it's not really traditionally charged for. It's a part of the looking after, because the other thing about seromas is you often have to repeat it. If you do get a seroma, you often have to repeat it, because you aspirate it and it can kind of come back, but it comes back again. So it's something that's an ongoing thing often. So they can be a bit of a nuisance, seromas. Not usually not a disaster, but they can be a nuisance. So yeah, as I said, we do it, but not on patients of other clinics. Sorry, this. Do you want to use my instruments? I have plastic surgery instruments and other. Who's that? Rexo? No, I'm fine actually. Fine for instruments at the moment, but thank you very much for offering the use of your instruments. But we're okay. I've got instruments. Thanks. So next question: can you remove a belly button piercing hole? Belly button piercing hole? Yes, you can. The problem with kind of piercing holes, it's not uncommon to get people wanting piercing holes removed, is that a piercing hole has to be kind of excised. You have to kind of core it out, because obviously it's going through and through, whether it be a belly button or an ear or a nose or a lip or whatever. It's going through kind of all the way through, kind of obviously. So you have to core out that hole, because it's kind of epithelialized. It's a skin-lined tunnel, really. And you have to core out the whole tunnel and then close the whole tunnel down. But that means it's going to leave you with a scar on your skin. And so sometimes cosmetically, the scar can look similar to what the piercing looks like. Obviously, it won't be a hole, but it'd be kind of like a red mark. And also, because you have to cut out that whole tunnel, the scar is a little bit bigger than the piercing hole was. So the scar is often bigger than the piercing hole. So it's a dubious one. Piercing hole removal surgery is like, yeah, it needs consultation, really. Needs a chat to see whether you are realistic about what you're going to achieve, because we don't want to make you unhappy. We don't want you to say, hold on a minute, it looks worse than it did before, because that is a risk. To be brutally frank with you, that is a risk. It could look worse than it did before, because you could end up with, I mean, we're not talking crazy things here, but a little bit of a bigger mark than what the hole was. Now, it won't be a hole, and sometimes I understand, you know, if you're moisturizing and stuff like that, you can get moisturizing cream and stuff in the hole, and that can be a nuisance. So obviously you get rid of that problem. It's no longer a hole. So if the whole aspect of it is a problem for you, then maybe having it removed would be a good idea. But if the look of it is, if it's the look of it you don't like, if you don't like the cosmetic aspect of it, then I would be anxious and cautious about removing it, because you might not like the look of the scar. In fact, you might think the scar looks worse than the hole looked. And so it is something to be consider before you go ahead with the surgery, because if you are unhappy with the scar, not an awful lot you can do about it, to be quite frank with you. If you have that piercing hole removed and you've got a little line scar and you don't like it, it's like, unless there's a specific problem with the scar, then there's not an awful lot you can do about it. So yeah, it's a tricky one, but piercing holes is a tricky one. You might think it's easy, you might think it's straightforward. Yeah, get a plastic surgeon, he'll remove that. Not, you know, yes, we can remove it, but ... Yeah, it's a consultation. What we've got going on here. Check my quality one time. I am sure you like my quality and order from me. It's okay. No, I'm all right with the quality we've got. Hi, do you offer Vaser and Renuvion skin tightening at your clinic? Thanks. Hi, Loco. No. No, we don't. Now, Vaser is ultrasound assisted liposuction, and I have reason to believe, don't quote me on this, but I think CC Cat does. She's just around the corner from me in Edgbaston. I think she's got a Vaser machine. It's a specific machine you need, and we don't have that machine at the clinic. Yeah, so it's an assisted. I do power assisted liposuction, suction assisted liposuction, normal liposuction. I don't do the assisted forms. Renuvion, I think Fulvio Urso Biada, he's got a clinic in Windsor. What's his clinic called? This is annoying now. I can't remember what his clinic's called. Sorry, Fulvio, I've forgotten the name of your clinic. But anyway, the other remember chatting to him recently. I think he was talking about Renuvion. I think he was talking about that, saying how great it is. So I think he could offer that. That's going to annoy me now. Fulvio Urso. Oh, that comes up by Arda. There we go. Windsor. Yeah, here we go. Plastic surgeon, award-winning plastic surgeon. He's an award-winning guy as well, Fulvio, apparently. Well done, Fulvio. He's got awards. Eterno 360. Eterno, yeah, Eterno clinic. There you go. That's his clinic. So yeah, so Fulvio, I believe, does Renuvion, and they're both good people and good surgeons, and so I can point you in the direction of those people. Fulvio at Eterno 360 and CC Cat at the Cat and Co clinic it's called. What we got? Do we offer? I mean, reflecting on this. So, do we offer mostly? Reflecting on this Q&A so far, have I actually? Oh, areola reduction at the beginning. We do areola reduction. So I haven't quite, not really speaking that much about that. Got to think about that. Am I? Anyway, we'll gloss over that. So, do we offer Mohs surgery? So yeah, that's a no as well. So Mohs surgery is a type of surgery. It's for high risk skin cancers, and what it involves is cutting off the skin cancer, cutting off what you can see. Then you take a sort of tangential sliver from the base of the wound, like the whole. So you have a map of the whole base of the wound, and while the patient is still like on the operating table, you go and look at it under a microscope to see if there's any cancer left behind. And if there is cancer left behind, like north, south, east, west, wherever it is, you go back and take a little bit more out of that, like east portion, for instance, if that's where it is, and then you analyze that sliver, and if there's more at the east portion, you take another bit of the east portion. You just take another bit away. So it's for high risk skin cancers with very indistinct margins. Sometimes it's very hard to see where the edges of the skin cancer are, especially skin cancers are in difficult areas, eyelids, lips, noses, things like that, where it's kind of difficult to reconstruct. So that's what Mohs surgery is. So it's quite kind of labor intensive. It takes a long time because you're actually waiting there with a kind of dressing on while you're waiting for that histological result. And then if the histological result isn't clear, you might need a further excision and then another histological result. So it's hard to know how long it's going to take. And it's usually offered by dermatologists, specific dermatologists, usually kind of trained in Mohs surgery. So Mohs is M-O-H apostrophe S. I think the guy was called Mo. Frederick, was it Mo? I can't remember his name. Anyway, and it's kind of not a commonly performed thing. Most skin cancers are kind of cut out with a margin of normal skin, sent away, and then a couple of weeks later we tell you whether it's complete or incomplete. And if it's incomplete, you might have to have it a little, a bit more removed. That's a kind of standard way of doing it for the vast majority of skin cancers. But as I say, for high risk ones with indistinct borders, Mohs surgery is a technique, but it's only a very small number of skin cancers that are treated that way. And we don't do it at the clinic, and so I don't know. I don't think it's that common. I don't know. Actually, maybe it is. I don't know. I don't think it's that. I think it's quite a big deal, because then you don't know what you're gonna. You don't know whether you're gonna be able to stitch it up. So if it's kind of not very big bit you take out and it's all clear, happy days, you can stitch it up. But if it's like massive, if you keep on going on and on and on and on, and you have a massive wound, then you might need skin graft, you might need a local flap, you might need skin moved around the area. So it's kind of like, you're consented for excision of skin cancer and reconstruction by maybe a skin graft, maybe a flap, maybe this. And sometimes the dermatologist will work with the plastic surgeon. Sometimes the plastic surgeons are not in the same place as the dermatologist, so you have to kind of put a dressing on it, and then you go to the plastic surgeon and they don't know what they're going to get, and they don't know if they're going to get a little thing that they can stitch up or a big thing that they need to do some big reconstruction on. So it's interesting technique, shall we say, and it's quite labor intensive and quite time intensive. So what we got? Loco, what you got? With regards to arm lifts, do you offer these, and have you performed lots of these surgeries? Yes, Loco, I do. There you go. That's something I do. Yes, I do arm lifts, Loco. So one, I do arm lifts. Two, have I done lots of them? I wouldn't say loads. I wouldn't say it's a massively common procedure. When you're looking at body contouring, so most of my work is breast and body contouring. I've got to be honest, of late I've been focusing more on the minor ops and things. I am doing a bit of the major procedures back again, just to help the other guys. I'm trying to build the other guys at the clinic, and trying to kind of support them. So it's not all about me, is it? But I can definitely talk to you about arm lifts. When you talk about body contouring, and my practice is breast and body contouring, I don't really do faces. I just do breasts, tummies, arms, thighs. The vast majority of work is breast lifts, tummy tucks, really, when you're looking at the trunk. Arm lifts and thigh lifts are not very common. They're nowhere near as common as breast lifts and tummy tucks, simply because the scar's hard to hide, basically. And you know, body contouring is done because you don't like the look of your arms, for instance, and you're like, I can't wear short sleeves, I don't like my arms, I want them to look better. But then an arm lift involves a big scar, and the scar goes down to the elbow, you know, just above the elbow. So it's quite a big scar, and it's visible in a short sleeve top. And we try and hide it so it's kind of neutral. So if you've got your arm by your side, you're okay. But if you put your arm up, you can see it. So it is not for everyone, should we say. So I have a discussion with people, and you need to think about whether it's actually something that you want to take on, because you are swapping one cosmetic issue for another cosmetic issue. And in my experience, it's really people who've got massive weight loss, got a huge amount of skin, might say, look, you know, it's really uncomfortable and I've got this skin and it's, you know, I really just want to get rid of the skin, and the cosmetic issue is obviously a thing, but it's not the overriding thing, it's the functional thing of all that skin hanging there. But if it is mainly cosmetic, you don't like the look of it, you have got to think about having an arm lift, because it is hard to hide the scar. As I say, breast lifts, tummy tucks, you can hide the scar a lot more easily with those surgeries. So those surgeries are a lot more common. So I have done them, but I wouldn't say I've done lots. I probably, I don't know, I should know probably how many I've done, but I wouldn't be surprised if it's something like 20, 30 maybe. You know, it's not like I haven't done hundreds, you know. So yeah, you might find someone who's done hundreds. I know there probably is someone out there who's done hundreds, but as I say, in my practice it's not a common body contouring procedure, simply because of the visible scar. So that's I mean, it usually fades, etc., but yeah, that's harmless for you. Recovery time following multiple mole removals. I want to have a few moles removed from my face, but I have a dentist appointment coming up soon. Should I wait until I have been to the dentist before arranging an appointment? Yeah, I would. You don't want the dentist messing about your face when you have mole removals on your face. I mean, I guess it depends where they are on your face, but I mean, they're going to be face, aren't they? I mean, face is there, so it's right there. So yeah, I would wait. I mean, you know, this sort of stuff is elective, it's planned, so it doesn't have to be done at any particular time. So if you've got a kind of more pressing issue, i.e. dentist, get your dentist sorted first, because you don't want to do something and then your dentist pulls on your mouth and your stitches pull and you think, oh my god, he's just pulled, but you know, it really hurt because I'm pushing my mouth. And you know, you don't want to walk in the dentist with like fresh kind of stitches or scars on your face. Yeah, so I would wait for the dentist. I would say that would be the sensible thing to do, the safe, sensible thing to do. Wait for the dentist and then get your moles removed, because we can remove your moles anytime, and the dentist presumably is like, oh, you've got an appointment here and there, so they're probably a bit less flexible than we are. If it is us or whoever, probably the dentist, I would imagine, is less flexible. Yeah. But not only that, your moles are not going to be affected by the dentist. So if you have your dentist first and then we do the moles, we're not going to affect what the dentist has done, but the dentist could potentially affect what we've done, put it like that. So as I say, it would depend on where your moles are, etc., but broadly speaking, I would say get your dentist done first, because that's the safer way of doing it. There's no way we're going to mess up the dentist thing by doing your mole thing. I think I've made that quite clear. What we got here? Okay, great, thank you. It's definitely a trade-off. The scar's definitely not pretty. Yeah, loco is a trade-off. You're right. A lot of things are trade-offs, and it's about being informed decisions, informed consent. That's what it's all about. C&T appointments. If I book a C&T appointment and during the consultation decide not to proceed with that, would there be any further charges? No. That's kind of, well, actually, it's not the point. The point is you have one appointment, so it's not the point. But the fact is, yeah, you don't know. There's no charge. If you come and don't have the procedure, there's no charge. And I always say to everybody, look, there's no problem. I'll, you know, always say, look, if you think if you're, I always say, look, I'm going to just describe what we're doing here, what the plan is. But if you, I don't know, if you decide not to have the procedure for any reason. That's, you know, if you decide you don't want it today, if I say something and put you off, you think, hold on a minute, I don't like the look of this place, or I don't like the look of that guy, or I don't like the sound of that scar, or I've got to go to see the dentist next week, you know, whatever the reason is, we'll say, look, go see the dentist, and come back another time. It's not a problem. So yeah, it is not a problem to not proceed to treat, and it happens not that often, but it does happen. Often people come and say, I'm going on holiday to Ibiza next week, is that all right? And we're like, keep the sun off it. Like, well, yeah, not really. You should probably come back in the winter, or, you know, come back when you're back from Ibiza, because it's not good to get the sun on scars and things like that. So that happens every now and then. People are, you know, doing something, going skiing, and, you know, they might fall over and like, well, don't have it done now. So yeah, there's no problem in not having it done. There's no kind of tie-in or anything like that. We don't hold you to it. We don't strap you down and make you have the procedure. Right, I'm out. Well, thank God for you, Loco, and for the and for Rexo, for your comments. So thank you for your comments. I'm sure your instruments are very good, Rexo. I am going to see what I have done in the oven. I just put something in the oven, and it's a bit of an experiment. And so the adventure carries on for me, but unfortunately for you, this is where it ends, because I've got to go and do the oven thing now. So I wish you all a good evening, and I will see you next Tuesday, I guess. What's happening next Tuesday? Probably the same, more of the same. For goodness sake, send me some questions, or if not, just ask on the day, like Loco did. And I will take care to yourself, Loco. Have a good evening, and I'll see you